Dr. Tony. I'm gonna stick with the endocrinology theme. We'll kind of go through every hormone group day by day a little bit. So let's do testosterone. All right, I know it's a little male oriented, but it's just what's on my mind. So testosterone is pretty important for for actually men and women. So very common that women get it as a hormone replacement, part of their hormone replacement package. We do that here. We're able to test it in office. But let's go over male kind of primary versus secondary hypogonadism. So primary hypogonadism is when the testicles themselves are failing. And symptoms of low testosterone could be numerous, could be depression, even some people get anxiety. Too much testosterone can also cause depression, anxiety, so you gotta really be in the sweet spot. Low energy, low libido, fatigue, some physical manifestations, gynecomastia, which is breast tissue, and smaller rubbery testicles. Those are some physical exam findings that are common. So want to differentiate between the two. And this is where most people, unfortunately, and the providers, which I would not include physicians into that category, and even unfortunately some physicians just do this wrong. So your initiate evaluation for hypogonadism, you got to check the pituitary axis, because it's your pituitary that tells your testicles to make testosterone. And if your pituitary hormones are inappropriately low with low testosterone, then there could be not primary hypogonadism, could be secondary, meaning your pituitary hormone are not doing what they're supposed to be doing to tell your testicles to make testosterone. Conversely, if your pituitary hormones, I'm talking about FSH and LH specifically, are elevated, right? I call it kind of the pituitary is kind of the drill sergeant of your endocrine system. It tells all your organs basically what to do, what hormones to make. So I call yelling at your testicles to make testosterone, so the FSH levels and LH levels are elevated, and your testicles are like, nah, I don't care, I'm not making testosterone. That's primary hypogonadism. The low pituitary hormones, the low testosterone free total, that could be secondary, originating from the pituitary. Why that's important is because you can have a pituitary tumor causing that. And you talk to any endocrinologist in town, they'll tell you about how many cases that are just missed and not treated by going to all these little T clinics and not doing a full examination. So real important that we differentiate those. One of the blood tests we can help in that situation is a prolactin. The prolactin level is going to invariably be elevated in most pituitary tumors, even if it's not a prolactinoma, which would be the most common cause, but it just is irritating to the pituitary and cause release of prolactin. And so really important, this isn't just something that you should be going online and randomly doing and just getting someone to hand you out testosterone. You should actually have a real physician who understands the whole physiology to do this, because you can over replace, have too much testosterone, and that could cause too much, we call polycythemia, too many red blood cells, which thickens the blood, and you can have a heart attack, stroke, Budd-Chiari syndrome, where it clots your liver and have hepatic failure. That's something that we like to avoid in medicine. So these medicines are very helpful, but they can be done wrong. So that's a little 101 of hypogonadism prepper course for you. So tune in for more.